All right. So welcome and thank you everyone for joining today's webinar. Today we're going to talk about emotions and why it's important to stay connected to your emotions and aware of your emotions in order to manage your skin picking, but also in order to lead a richer life. My name is Dr. Sofia Wenzler. I'm a licensed clinical psychologist and also the clinical lead at Skinpick, the online therapy program that is basically bringing this webinar to you. And I just want to encourage you to stick around until the end. We're going to have about a 40-minute presentation, and then there's going to be a 20-minute Q&A section. You can write your questions down already now in the Q&A section, but you can also wait until the end, and then I'm going to try to answer as many of your questions as I possibly can. All right, so there's a lot to cover. Let's just jump right into it. What are we going to do today? So first of all, we're going to talk about what emotions are good for. Why do we even have those pesky feelings? And what does it mean to have an emotional experience? What does it mean to feel? Then obviously we're going to talk about the role of emotions for skin picking and why keeping track of your emotions, being aware of your emotions can really help you. And also I'm going to practice one emotion regulation technique that I find very helpful with you together in this webinar, and then you can continue practicing afterwards if you like it. Yes, and then we're going to conclude and obviously go to the Q&A section. All right, so just to kind of like open yourselves up to the topic itself, I want you to do a little exercise with yourselves and just for a second or a few seconds, try to think of as many emotions as you possibly can and count how many you can think of. And I'm going to give you half a minute for that. How many distinct emotions can you come up with? Okay. I cannot ask each and every one of you how many emotions and which emotions they thought of, but I actually ask this question a lot in my private practice. So I know that usually people come up with about 5 to 10 different emotions, and that most of the people that I ask are actually surprised because they think they would be able to think of more of them because actually our emotional experience is so rich and we think there's so many different intensities and shades of emotions. So if you really want to ask yourself how many emotions are there, then there's two really interesting works of research that I want to present to you. The first one is from 2017. So a team of researchers basically tested 800 women and men and presented emotionally evocative video clips to them, and then kind of analyzed the responses and found that there are 27 different emotions that they could have come up with. This is a study by UC Berkeley. You can also find it online. They have a really cool interactive map where you can see how those emotions are also interconnected. And so the different emotions they came up with, or they found, they didn't make them up, were admiration, adoration, aesthetic appreciation, amusement, anger, anxiety, awe, awkwardness, boredom, calmness, confusion, craving, disgust, empathetic pain, entrancement, excitement, fear, horror, interest, joy, nostalgia, relief, romance, sadness, satisfaction, sexual desire, and surprise. If in the exercise at the beginning you thought of any other emotion than that, then congratulations, you were very creative. However, you can also kind of comprise those and think about emotions in a little bit of a different way. And that thought is based on the work of Paul Ekman. He's a very, very famous psychologist. If you ever took a seminar on psychology, you might have heard his name. He did most of his work his most influential work in the 70s. And he thought about emotions more in as like which emotions are universally or by part of every human's experience wherever in the world they live. And he traveled all around the world, even to very, very faraway places, like the four people in New Guinea that have never been, at that point, had never been exposed to Western culture or media. And he found that there are 6, and later he added a 7th emotion that are expressed and recognized anywhere in the world by any human being. And those universal or basic emotions are fear, sadness, happiness, anger, surprise, and disgust. And you see this person from the 4 people in the picture basically mimicking those emotions. He later on added contempt. So that's another way to look at it. And then you can, for example, find variations of fear like anxiety, panic, or whatever. And, so it's basically, in the eyes of the beholder, how many emotions you really want to think that there are. But more importantly, why do we have emotions? A question that we don't naturally ask ourselves, but it's an interesting question because they are such a fundamental part of our daily lives. And nothing that's biologically as universal as emotions that are experienced the same way, even by people who've never been exposed to Western culture, is by accident. There's a reason that they are there. And individual emotions, just like the ones you're seeing there, those are, again, the universal emotions by Paul Ekman, just mimicked by Western people. Those are important for survival. We need emotions to survive. Fear is to keep us safe. Anger is to protect us, to make us fight when we need. Happiness is to motivate us to go out into the world. And disgust is there to protect us from things that might kill us. All of those reasons make a little bit more sense if you think about human beings during earlier times or when they were cavemen. But, we haven't changed so much, right? Like our body and our biology hasn't changed so much. And we need our emotions, first and foremost, for essential survival. And then we also need them to be part of a social group. And those emotions I sometimes call social emotions. Emotions such as embarrassment, shame, guilt, pride, and contempt that come up mostly when we are in a social context or when we imagine that we're in a social context. And that's, again, you could say, emotions that help us be part of a social group are also for survival because we cannot survive outside of a group. But yeah, it's still a little bit of a different aspect. So they facilitate connection between individuals. Emotions like love, empathy, and compassion contribute to cooperation and mutual support. And emotions such as embarrassment or guilt establish social rules and make us understand which rules, and they can differ from culture to culture, we have to adhere to in order to not be excluded. And then lastly, we need emotions to stay connected to ourselves, because emotions in the end point us towards a need that we have to meet. And if we suppress our emotions or kind of don't listen to our emotions, that means we're not connected to our needs, and it means we're not connected to ourselves. So emotions are very important. But what does it mean to actually have an emotion? What does it mean to be emotional, to have an emotional experience? What does it mean to feel? So if you break down the experience, you could say that every emotion comes with certain thoughts, a certain feeling in your body, and a certain message as of what you're supposed to do now, like an action tendency. And all of that together makes up your emotional experience. So what happens in your head what thoughts, how do thoughts and emotions, how are they connected? That's actually something that we covered in a past webinar when we talked about thinking errors or cognitive distortions in depth, and how the way we think can even lead us so far as to suffer from a depressive episode. And basically, it makes a lot of sense. You know, something happens to you, and then the way you interpret it determines the way you feel. If you fail at a test and then think, I'm a complete failure, you will feel very bad about yourself. If you say, well, that sucks, next time I'll study more, you will also maybe feel bad about yourself a little bit, but also you'll feel compassion towards yourself and motivation. So that's one thing, but also our emotions then determine the way we think in return. If I think, well, I failed the test, I'm a complete failure, I will feel bad about myself, maybe ashamed. I will be very self-critical, and then I'm also more prone to think negative and self-critical thoughts afterwards. So there's a really, really close connection between the two of them that most people are aware of. What people sometimes forget is that emotions are deeply rooted in our bodies. You can understand that already by looking at how we sometimes talk, how it's kind of expressed in our language. We say things like, my heart is racing when I'm nervous or excited. We say, I have butterflies in my stomach when I'm in love. And sometimes we say things like, I have a gut feeling. However, a lot of people are not really connected to how they experience emotions in their body. And that is a shame, because the moment I connect to the physical feeling of an emotion, I'm really connected to it. And I also have a better chance of actually processing my emotions. This can be also very relevant for things like processing trauma. There's a really, really interesting study that looked at whether the way we feel emotions in our body is actually similar from person to person. Are there patterns? And they tested 700 plus participants, showed them words, stories, movies, or facial expressions that actually evoke emotions. And then I asked them to identify on a huge silhouette of a body where they felt the emotion, and also whether they felt an activation that you can see in yellow and red colors, or a deactivation that you can see in bluish colors. And they found those patterns of like how and where in your body you feel the emotion, which is really, really interesting. And if you think about it, it makes a lot of sense. If you think about the fact that your emotion points you towards a need. For example, if you look at fear, you can see fear in the upper row, and then anxiety, which is similar, in the lower row. That's an emotion that is connected to our need for safety. When I am afraid, then my body is basically prepared to go into fight or flight mode, which means it's preparing themselves to run away. What do we need to do to run away? We need to pump a lot of blood into our veins, and we need to breathe faster. So you see a lot of activation in the chest area. And if you take more time to look at this map, you will see that a lot of those activation or deactivation patterns make a lot of sense. Oopsie. Okay. Lastly, our emotions tell us something. Just as I said, sometimes, for example, anxiety will tell us to run away. If that makes sense, it's for you to judge. And that's why I basically kind of wrote this down very simply. The emotion connects us to the urge or tendency to act. And that connection is very strong. That connection is very hard to break. However, what you actually do afterwards is under your control. And that's also mostly, or a lot of the times, what we do in therapy, right? In therapy, I'm not going to ask you to not feel your emotions. And I'm also certainly not going to ask you to not listen to what your emotion tells you to do, but we're going to work on which behavior you actually want to show in the end, right? If you're angry, I want you to understand that you're angry, and I want you to understand that you want to punch someone in the face. But then you can also express your anger in a different way in the end. All right, so now we know how many emotions we have, more or less. We know that emotions are important for survival, social connection, and to be connected to yourself. And we know that they involve thoughts, a physiological sensation, and some kind of action tendency. Now, why do we even talk about emotions, in this webinar that's kind of connected to a therapy program for skin picking? And most of you will have a very quick answer to that, because emotions play an important role for skin picking. You could even say that skin picking is some kind of emotion regulation skill that can be highly automated and works in the short term, but causes problems in the long term. But I want us to just look at it a little bit more in detail. And if we look at the cycle of skin picking, where we usually have, a trigger that causes the urge to pick, then the actual picking episode, and then short-term as well as long-term consequences. Take a second and think about where in those steps emotions come in. Where in those steps do emotions play a role? The way I see it, the emotion can be a trigger for skin picking. Emotions such as anxiety, sadness, etc., can trigger the urge and the following skin picking. The short-term relief that we feel can be some kind of positive emotion, and then the long-term consequences can be negative emotions such as shame, frustration, or guilt. And those negative emotions can then kind of like become the next trigger, but they also definitely maintain the cycle. So emotions play a very, very important role for skin picking, and staying on track of kind of like being aware of your emotions and being able to regulate your emotions in healthier ways can really also, without even really treating the skin picking itself with techniques such as habit reversal training that we teach at Skinpick, even just finding healthier ways to regulate your emotions can already make a difference. All right, so tracking your emotions. What is to say about that? Well, tracking your emotions basically means staying aware of your emotions. And the topic of awareness sometimes feels like I kind of like sometimes feel like a broken record in how much I talk about the importance of awareness. And then I think, why do I talk about it all the time? It's because it's so important, and also because it's so hard, because it comes up and again, because we avoid our emotions left and right all the time. And we have to make an active effort to actually become aware of our emotions. And why do we avoid them? Because feeling negative emotions sucks. It's a very, very unpleasant experience. And also, the way we live and our society and technology gives us a million ways to avoid our emotions. We only need to, take our smartphone, and then there's more problematic ways to avoid our emotions, such as skin picking. So it's not an easy thing, it's not, oh yeah, be aware of your emotions, okay, great, I'll do that. It's difficult, and there's a lot of hurdles in the way. So here are a few kind of pieces of advice on things you can focus on when you want to connect to your emotions and stay more aware of them. So first of all, try to tune into your body throughout the day. Even set yourself reminders to do it a couple of times a day. There's always emotions present, so even if it's just mild happiness or something like that, just take moments to tune into your body. The moment you connect to your body and the way the emotion is expressed in your body, you're super connected to your emotion. And then in order to kind of dig deeper, name the emotion. This also sounds simple, but name the emotion. Sometimes there's several emotions present. Be as specific as you can. For example, if you're saying, well, it's like some kind of anxiety, then think about it. What is it? Is it fear, panic, agitation? Is it worry? Is it stress? What am I feeling? Stress is not an emotion. Take that out. Then define the intensity. You can ask yourself, am I angry or annoyed or impatient? Or you can also think, okay, am I angry from 1 to 10? Where am I angry from 1 to 10? From 0 to 10? And finally, try to reflect on it. Try to think about it. Okay, wait, I feel anger in my chest. I would say it's annoyed on a level of 4. What's going on? Where is this emotion coming from? What is it telling me to do? And why am I feeling that way? And the moment you understand yourself better and are connected to the emotion, you will already feel a certain amount of relief. To demonstrate this further, I kind of thought of this example of how emotion, being aware of an emotion and then digging into it usually or oftentimes looks like in therapy. Okay, so let's say there's a patient coming in and he says, and then I told her about that presentation that I had to prepare for next week. Listen, she didn't even react with 1 word. I walked away and didn't talk to her for the rest of the day. Now I feel so bad I completely overreacted. Okay, so we have an emotional experience right here, and let's see how they now look at this. Therapist says, let's see if your response was really disproportionate. How did her not reacting make you feel? Patient, it made me feel like she doesn't care about me. Therapist, made you think that she doesn't care. But how did you feel inside? Patient, I felt like my chest wanted to expand and my head felt warm. So at first, the patient kind of tells the therapist about their thoughts when asked about the emotions, which happens a million times in therapy all the time. Because they're so closely connected, our thoughts and emotions. But then when, pushed a little further, he connects to his body. And the moment he's connected to his body, he's connected to the emotion. Therapist, okay, so you felt it in your chest and head? Patient, yes. Therapist, do you have a word for the emotion you felt? Patient, maybe I was annoyed? Therapist, I think we're heading in the right direction. So he's not telling him anymore. He's just, encouraging him to look at it more. Patient, maybe even a little bit more. I was furious. Why was I so mad? Maybe she just didn't pay attention. She didn't mean to make me mad. Okay, now we're reflecting. Dig a little deeper. Was anger the only emotion present? Patient, I don't know what you mean. Therapist, you said earlier that you thought she didn't care about you. What emotion could that thought evoke? Patient, disappointment, pain. You know what? Now that I think about it, I also felt ashamed. I am extremely stressed before presentations and it's hard for me to open up about it. Therapist, listen, now that I understand the situation better, I can completely understand why you felt and acted the way you did. So this is also important to remember. If once I reflect on my emotions and understand where they're coming from, or once other people understand where they're coming from, they are going to be more understanding and compassionate towards us, and we're going to be more self-compassionate. I kind of use this example also to show you how difficult this can be, and how sometimes being supported in this process of, looking at your emotions and starting to gain awareness and understanding of your emotions can help. And that's why I want to show you another way you can do it. Like, obviously you can, reflect on it with a therapist and you can try alone, but kind of like a middle way that you could use is a tool that we use in our program at Skinpick. It's called the self-monitoring tool. And that one helps you to not only stay in touch with your emotions, but also to connect them to the actual picking behavior. So in the self-monitoring tool, through a few screens, you'll be guided to analyze when, where, and why the emotion came up, not when, where, and why an urge or actual picking behavior occurred, which body area was affected, etc. And then you're going to connect your urge or picking behavior to the emotions and thoughts that they were connected to or triggered by. And the tool also has some kind of evaluation statistics where you constantly see, which emotions trigger the picking a lot, in which daytime, which places, just, see patterns that emerge over time. And if you actually subscribe to the program, then you'll also have a therapist at your side who will look at this tool and your entries together with you and do this reflection with you. All right. So whichever way you choose to track your emotions, whether it's a self-monitoring tool or through therapy or on your own, at some point you're gonna gain this awareness and you're gonna see how many different emotional experiences you go through every day. But then what? Like, what do I do with those emotions once I am connected to them and feel them? And that's a very good question. And so what I want to do is I want to talk to you about emotion regulation. Well, how do I regulate emotions? And I do find this term a little bit problematic because it kind of implies that regulating my emotion maybe helps me to get rid of it, makes the emotion go away. But that is not true. Regulating my emotions means staying in touch with my emotional experience, but also staying in control of what I'm doing and of my life during the emotional experience. And so here are a few examples of what emotion regulation is not. So, and I want to use the example I presented to you before to kind of demonstrate that. So this patient, right, comes in and tells his therapist his therapist about the fact that he had to prepare a presentation and that his partner didn't react to him when they talked about it. And then his way to deal with his emotions is, I walked away and didn't talk to her for the rest of the day. Now that's what we call letting the emotion take over. He is connected to his emotional experience. I don't know how aware he is of it. And then he just blindly does what the emotions tell him to do. And here's a quick reminder, what he's feeling is anger, pain, and shame. So what his emotions tell him, the anger tells him to fight back, punish his wife. The shame tells him to hide. And the pain tells him to kind of take care of himself and lick his wounds. And listening to this mix of emotions, unaware and not in control, leads him to this passive aggressive behavior of just, going away and showing his wife that something happened that's not okay with him without giving her an option to correct her behavior. And that way, he's going to stay alone with his emotions. And the situation stays unresolved. So that's not helpful. Another thing we don't want to do is suppress or run away from our emotions. If he had reacted in a different way, for example, if he would have said, this was too much, I had to just turn off my head a little, so I binge played for the rest of the night, some kind of computer game, that would be a very common way of shutting off your emotions. Other ways could be drinking alcohol, engaging in excessive sports, by overcompensating through food, picking your skin, pulling your hair. All of those things are kind of a way to suppress your emotions. And cause problems in the long term because you cannot just push emotions away, they will find their way. And another very common way to deal with emotions is invalidating them. Just not accepting that the emotion is there. which he did a little bit afterwards when he said, now I feel so bad, I completely overreacted. He didn't overreact if we really understand, where he's coming from and why this is a sensitive issue for him. And telling himself that he overreacted also really doesn't help. But some people do this on a regular basis, specifically people who tend to be people pleasers. I don't want to say be people pleasers. I don't want to tag people. People who engage in people pleasing a lot, who are very afraid of conflict. So if they, for example, feel an emotion that would actually require them to set a boundary or talk to another person about it, they might say to themselves, why should I be hurt? She probably has her reasons. She has so much on her plate. Why am I such a whiny person? So what if she didn't pay attention? They will say things that kind of invalidate their own emotions in order for them to think the situation is okay, nothing bad happened. I didn't feel this emotion. This emotion is things unimportant. Everything's all right. And then they also don't have to confront anyone or do something with their emotions. But that way they don't stay connected to themselves, and they certainly don't, step up for their own needs. So we don't want to let the emotions take over. We don't want to suppress the emotion or run away from it. And we don't want to invalidate it. What now? What do we want to do instead? Good question. So wait, how much time do we have? Oh, we have time. Before I tell you or describe you the emotion regulation strategy, obviously there are many, but there's one that I find very helpful. And before I describe it, I actually would want to invite you to just practice it with me. That will give you much better insight into it. And that mostly requires you to, I'm going to guide you through it. It's a 4-step RAIN, like RAIN, approach on how to deal with an emotional experience. And yeah, I want to just invite you to kind of like go with me and try this out. And all you're going to have to do is close your eyes. You can do this right now. Close your eyes. Find a position, whether you're sitting or lying down or standing, that is comfortable to you. And take a deep breath in through your nose and out through your mouth. Other one. And then I want to invite you to connect with an emotional experience that you're maybe having right now, or that you had today, or that you had lately, and kind of bring that emotional experience up again. Try to connect to it. Try to feel it again. Try to bring it back right now. And once you feel like you're connected to this emotional experience again, I want you to, first of all, gently turn towards what you're experiencing in an open and non-judgmental way, and tune into it. Tune into what you're feeling right now in your body, to the thoughts and sensations that come up. And maybe even give it a name. Feeling stressed, feeling embarrassed, feeling sad. Just recognize what's going on. And in the second step, I want you to allow yourself to feel that way. This is what's happening. I'm not going to change it, act on it, or try to push it away. Yes, that's what I'm feeling, and that's okay. Feeling bad or experiencing pain is part of life. Cannot avoid it. And then in a third step, I want you to investigate. Be curious. What's going on? What am I experiencing in my body? What does this feeling want from me? What am I believing about myself? And what am I believing about others right now? And then, in a last step, I want you to connect to your needs. What do you need right now? That's always so easy to understand. Think to yourself, right now, what I need the most is. Maybe there's something you need to hear. If you imagine a person who really, really loves you, what would they say to you right now? Maybe something like, I care about you, I'm here for you. If you've screwed up in some kind of way, maybe remind yourself that you're human. No one's perfect. If you're critical towards yourself, maybe you want to tell yourself something like, give yourself a break. And if you don't have the words to nurture yourself, maybe you want to put a hand on your chest or a hand on your abdomen or both. Maybe that will comfort you. Take one or two more deep breaths in this state. In through your nose and out through your mouth. In through your nose. Out through your mouth. And then if you manage to really close your eyes, just come back, open your eyes. Tune into the present moment again and into the presentation. So the technique we did right now, as I said, is called RAIN. RAIN stands for recognize what's happening, allow life to be just as it is, investigate your inner experience, and nurture. And this is a way to kind of deal with your emotions without pushing them away and comforting yourself while you have the emotional experience. The technique is very, very effective. A lot of people find it helpful, but it is most helpful if you repeat it. It doesn't have to be, 5-minute meditation every time you do it. If you practice it a little bit, the steps will be really easy to remember. And then sometimes it's just, a 20-second stop. You feel something difficult in your day, you remind yourself, breathe into it, allow it to be there. What do I need right now? And then you can just do it over and over again throughout your day to be more connected to yourself and more compassionate. You can find information about this everywhere on the internet. There's, guided meditations, information in a lot of different places. At Skinpick, we also have a dedicated tool for the RAIN meditation that our clients find helpful, and the steps here, just a short overview, recognizing what is happening, means to tune into the present moment, to recognize what's going on and to give it a name if you want. allow life to be just as it is basically just saying a huge yes to whatever shitty feeling you're experiencing. It doesn't mean you have to like it. It just means that you accept it and kind of soften your mental and automatic resistance to it. Investigate means, this kind of like reflection of trying to understand better where it's coming from. And then nurture, not always so easy, is slowly understanding what need is this emotion pointing towards, and what can I tell myself or do with myself now to comfort myself in this difficult experience. All right, and that's it for today. Let's conclude. We need all our emotions to survive, also the ones we don't want to feel, to thrive and to survive, to thrive in groups, and to stay connected to ourselves and our needs. Feeling means to be present and experience the physical sensations, the thoughts and behavioral impulses that come with an emotion, or that kind of make up the emotional experience. Emotions are a crucial part in triggering episodes of skin picking, in its short-term gratification, and also maintaining it long-term. And that's why keeping track of your emotions is key in order to learn with skin picking, but also in order to stay a more balanced life, to lead a more balanced life and stay connected to yourself. And you can do that through journaling, through mindfulness, through self-monitoring, or in therapy. And regulating your emotions means to recognize, accept, and console them. And there are no shortcuts. You cannot suppress them. You should definitely not let them take over your life, and you should not invalidate them. All right. Here just a quick reminder of the free resources that we offer at Skinpick. There are monthly webinars, as you are aware of because you're attending one. We have online forum and blogs on our website, skinpick.com. We have Facebook groups. We're on Instagram and TikTok, also through @skinpick.com. And yeah, we also have a promo code in case you want to subscribe that will save you $100 on the first 4 weeks. And now we actually got to the Q&A part of the webinar. So if you have any questions, please write them down in the Q&A section, and I will try to answer them. Oh, there are no questions so far. That's a first. Feel free. Write down whatever comes to mind. It can be related to our webinar or just general questions about therapy. Wait, someone raised their hands. And if you have a question, please write it down in the Q&A section. Also to the person who raised their hands. Okay, there are questions. How can you help someone that does not see there is any problem? That's a very broad question. I think I would need more background to that. But generally, you cannot, point someone towards their problems for them. You can only, you can only kind of, if they have a problem, I mean, this problem will cause negative consequences for them, right? So once the negative consequences appear, you can, ask them gentle questions like, what's going on? Where is this coming from? But yeah, you cannot convince, someone that they have a problem. They have to first understand it themselves. That's what I could generally answer to that question, but to be more helpful, I would need more information. Could you put the recognize checklist up again? Sure. What? This one you mean probably, right? The rain. Or no, you mean the recognized checklist here. This one probably. Okay. I hope that's it. Can skin picking simply be a habit? If so, how do we stop doing it? I would say skin picking is more than a bad habit because it's has significant negative consequences for the people who suffer from it. And it's not as easy to change as I don't know, maybe the habit of chewing with your mouth open. No, I don't have no idea why that came up first now. And how do we stop doing it? There are evidence-based therapeutic approaches to manage your skin picking. The gold standard treatment would be habit reversal training. We have a dedicated webinar on that you can also find on our YouTube channel, Skinpick. And that's also what we do at Skinpick. We have an online therapy platform that's therapist assisted that helps you deal with your skin picking. We also use different approaches, but generally the gold standard approach would be habit reversal training. Is there more male or female tendency to skin picking? That's a good question. I've recently seen mixed results on that research-wise. So there's some research that shows that there are more women suffering from it, and there's some research that shows that there are no gender differences. So I'm sorry, I don't have a clear answer for that right now, or research doesn't have a clear answer for that right now. How often? That's a good question. How often do people find they are doing the rain technique throughout the day? It seems like it would be a lot, especially if you are not used to being in tune with your emotions. It is a lot. And generally, if you want to change something as fundamental as that, about your, sorry, I just realized I also have to click on the fact that I answered the questions. Generally, just remember this is a step-by-step thing. If you're saying, you know, I'm not used to being in tune with my emotions, then once you want to open yourself up to your emotions, that's a long process. And I usually advise my patients, you know, when I do one-on-one therapy, to practice rain once a day. And then if they come back and practice 2 or 3 times, I'm really happy. And then the more you practice it, the easier it gets and the faster and the more automatic. At some point, I don't want you to remember, okay, rain, recognize, allow, investigate, nurture. It's just supposed to be like your automatic way that you react to your emotions. And so it's not, as I said, it's not supposed to be a 5-minute meditation every time an emotion comes up. And yeah, so step by step, if you manage to do it once a day, if you manage to do it a couple of times a week, and then, you know, improve from there, or even if that's what you're doing for a while, you will see it's going to influence, you know, every time that you have to deal with a negative emotion. So don't feel like you have to do it a certain amount of times. As long as you do it and try to do it more and more, it's going to be helpful. What if skin picking is tied to a physical sensation? Picking skin around your thumbs, it only happens if the skin is rough and irritated. Then, you know, I would advise strategies of habit reversal training. One of them would be stimulus control, meaning to kind of try to take care of your skin as much as possible to avoid rough and irritated skin. to seek out treatment for that, so you have less of a trigger, and then practice competing response that will kind of maybe even mimic the physical sensation that you get when you pick skin around your thumbs, but also other things like sitting on your hands can be helpful. And then really try to, our brain works in a way that we build connections all the time. So right now, you connect this physical sensation or maybe this physical urge that precurses the skin picking with the picking, and every time you feel the physical sensation to the picking, the connection gets stronger. So what you want to do is you want to reduce the trigger by practicing stimulus control, by reducing the irritation and rough skin. But also when the physical sensation comes up, you want to do something else that's less damaging to your body, and then practice this connection again and again and again, so it gets stronger and the connection between the physical sensation and your skin picking gets weaker. Right. Clicking done for all the questions I answered. Wow, okay. So someone wrote, "Hello, hope you're doing well. Thank you so much. I'm doing well. I am only 15 and my parents don't believe in therapy. I struggle with skin picking and it is very severe. I don't know what to do." That's such a difficult situation. I'm so sorry to hear that your parents don't believe in therapy. Maybe there's a school counselor that you could talk to, or an adult that is not your parents that could maybe kind of help you kind of talk to them. You could also write to our customer service. There is evidence that shows that there's therapy for skin picking, right? It's not, people say I believe in therapy or don't believe in it, but there are actual research articles that show that skin picking is a serious condition, and also that there are effective therapies for it. You don't even have to call it a psychotherapy, you can just call it habit reversal training, and maybe show them research about it. Basically, in a lot of countries, I don't know where you are, when you're 15, you can also seek out help on your own. The problem is just, to find the finance. So maybe if, you have a school counselor or someone else you can trust, or even, your family physician, to kind of like ask them for help, which is not easy, right, to open up and to talk to people about it. But yeah, our program is also free for people for teenagers aged 14, 15, if they're independent enough to do that. But again, then you have the cost. There's also a program for parents we offer. But yeah, it's such a difficult situation. I'm so sorry to hear. I think you have to connect to an adult that can help you seek help, or talk to your parents, or try to convince them by actually presenting evidence to them. Or what you can also do, obviously, is, we have more webinars and information about habit reversal training. You can also listen to that and inform yourself. And even without using the or program or being in touch with a therapist, you can already work on your skin picking, right? And try to just use the strategies that we teach about in our webinars, and that you can find online. That's maybe also another idea. All right. I hope that helped a little bit. Okay. What else? What do you recommend for scarring due to skin picking? Not sure I completely understand the question. it can be very difficult to deal with, like, psychologically, to deal with scarring due to skin picking. I would, you know, if there's any medical way to treat the scarring, I would treat it in order to not make this turn this into another trigger. If you're asking about what do I do if people see the scars, then you have to, you know, check in with yourself concerning whether you feel comfortable to open up and tell them about it, or if you want to, you know, think about something else you can tell them. Yeah, I find I don't understand don't completely understand the question, so I'm sorry. I hope this helped maybe a little bit what I said. Okay, we have a few more minutes left and 2 questions. To elaborate, my 14-year-old daughter picks her upper arms, chest, back, face, and has been to various therapists, including the Skinpick online therapy program. She is resistant to any more therapy and persists. There is no problem. Yet her arms and back are scarred, bleed, etc. I feel hopeless. So that's basically the reversed situation. Before we had a teenager who wants help and the parents don't cooperate. Now you have 14-year-old who doesn't cooperate. And you also tried the or therapy program. I mean, you know, therapy doesn't work if we don't have cooperation and compliance from the patient. And if she doesn't see the problem. Oh, maybe you asked in the beginning, like, what do you do with someone who doesn't see the problem? Now you elaborated further. To be perfectly honest, it sounds like she's not ready yet. It sounds like she's ignoring the problem, maybe because she doesn't want to face it, maybe she thinks she cannot handle it, or because she gave up on trying to change it. So it sounds to me like there is a step that she has to do in kind of, and maybe that's gonna take some time for her to actually admit to herself that she has a problem and accept help and try to do the effort and work on it. And that's not a step that you can do for her. And you can maybe just help her, you know, with dealing with things that trigger the picking, maybe, you know, help her with things such as stress management or dealing with her emotions, being there for her, asking questions, being open. I feel when you push a teenager a lot, at some point, if they kind of like close up and don't want to hear about it anymore, you have to take a break from it and then really leave the topic aside for a while, and then very gently, maybe later, maybe in half a year, maybe in a year, when you see some kind of opening, when you hear her or notice she's kind of like she's you know, sad about the damage that the skin picking is doing, then you can kind of like think about it with her again. Yeah, I think I would take a step back and then try to gently, you know, reapproach the topic later, and also maybe try habit reversal training together with a medication such as NAC if you haven't tried that yet. We're at the end of the time. Let's see what more questions do you have. Good question. Do you recommend using the rain technique when one feels the urge to pick, or any time of day? Both. Practice also when you don't feel the urge. You can even practice when there is no negative emotion present. You can just tune into yourself and feel whatever you're feeling. Yeah, both. Okay. What's more effective to stop picking, therapy or some drug treatment? Most effective is therapy with medication. There's actually a new review that just came out that showed that the best effects, specifically long term, are is therapy, but not any therapy. It's CBT, habit reversal training, which is a kind of CBT, or acceptance and commitment therapy. Those are the therapeutic approaches we also do at Skinpick. And if you combine that with a medication such as NAC or an SSRI, it can be effective. All right. Are there some people from other countries on online therapy at skinpick.com? We have clients from all over the world at skinpick.com, and also therapists from different countries. Can you repeat what RAIN stands for? Yes, I'm just going to go back to the slide. It stands for recognize, allow, investigate, and nurture. And if you look that up on Google or YouTube, you will find a lot of explanation. It's a very widely used and effective strategy. Could you clarify about NAC? So NAC is a medication that I have been asked about a lot lately. You can also look it up. And no, there's also another question about NAC now. I'm not a psychiatrist. I don't have any medical background, so I'm not going to recommend medication, and I cannot tell you which dosage to take. I can only tell you that there is research backing up that NAC can be helpful for people suffering from BFRBs, body-focused repetitive disorders, which includes skin picking, hair pulling, nail biting, and things like that. Mostly, the best effects you will have if you do therapy plus NAC. In the recent systematic review that I read, there is also evidence that SSRIs that are usually used for depression might be effective. That doesn't mean that every research study they analyzed. A review is basically a research study that looks at every other research that has been done in a certain field and kind of like tries to sum up the evidence, because one research article telling you that a certain medication can be helpful is not enough. You need several studies that prove that. And so the results are still mixed, and research about NAC is still new, but so far it seems like a promising direction. All right. Okay. And if someone, if Allison, oh, I'm sorry, usually I don't say the name, but it's just the first name. If you want to read that research paper, then write to our customer support and I will send you a link. All right, so our time is over. Thank you for all of those interesting and good questions, and thank you for sticking around until the end. And please stay up to date towards our upcoming webinars, and have a good morning, day, or night wherever you are in the world.